In Bethesda, the National Institutes of Health now treating a woman with tuberculosis. Not just a regular case of tuberculosis, though. This is an extremely drug-resistant form of the disease. The woman flew from India to the United States in April through Chicago's O'Hare Airport and spent time both in Missouri and Tennessee. She was in the U.S. for 7 weeks before she was diagnosed with this lung infection. And as we said, this patient is now in the care of NIH, and we are joined now by Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Disease at NIH. Dr. Fauci, it's good to have you along.
Good to be with you.
Let's talk a little bit about the kind of tuberculosis that this woman has. We know about some drug-resistant diseases, and particularly tuberculosis now, but this is a special subset even of those patients.
Right. It's referred to as extensively drug-resistant tuberculosis, or XDR-TB, which means that it is resistant to all of the standard drugs that we generally use for garden variety tuberculosis. So what you have to do is you have to look in your remaining armamentarium of drugs to try and find a combination of drugs to which this particular microbe is sensitive. And that's the dilemma, because that's not easy to do. When you have resistance like this, it's difficult to find drugs that are totally effective against this type of tuberculosis.
Doctor, we also know that this woman was in this country for 7 weeks before she was diagnosed. And in that 7-week period, is it also likely that she was infectious, that she was contagious, that maybe other people were possibly exposed?
Certainly, that there's that possibility, and that's the reason why the Centers for Disease Control and Prevention, the CDC, and the health authorities in the different states, particularly in Illinois, are doing what's called contact tracing, namely trying to identify the people to which this person came in contact to determine if the person indeed have gotten infected, to notify them and to monitor their health, and then also to do some TB testing on them at an appropriate time.
Doctor, sort of big picture on not this patient specifically, but this extremely drug-resistant strain of TB. Is it likely we're going to see more of these cases now, that maybe this drug has built up some sort of tolerance to the other antibacterials that are more commonly used to treat it?
I don't think we're going to necessarily see more of this. I mean, extensively drug-resistant TB is a global problem. It's much more of a problem in the developing world, in places like India, in places like certain Eastern European countries, in South Africa and other African countries. In the United States, the relative number of extensively drug-resistant TB cases that we see is relatively small. For example, between 1993 and 2011, there have been a total of 63 cases during that span of now, 7 or 18 years. So it isn't a common thing, but there's always the threat of it occurring, and that's the reason why you have to be very vigilant when you do get a case to make sure it doesn't spread.
Dr. Anthony Fauci is the director of NIH, the Allergy and Infectious Disease Unit over there at the National Institutes of Health. Dr. Fauci, many thanks for your joining us this afternoon.
Good to be with you.